This is Dr S Padma, Assistant Professor, Department of Biochemistry and Nutrition, Bhavans Vivekananda College of Science, Humanities and Commerce, Sainikpuri, Secunderabad. Today, I am going to talk about the liver function tests. The main objective of this topic is to explain the functions of liver, to outline the various liver function tests. This presentation is including three aspects of the liver function test: the functions of the liver, its anatomy, the tests for analyzing the liver function, and diagnosis of the liver diseases. First, let us know something about the structure of the liver. We all know that liver is the largest organ in the human body. It weighs nearly 1.5 to 2 kgs and is comprised of 4 lobes. The two major lobes are the right lobe and the left lobe of the liver. Liver also receives dual blood supply. Additionally, it has an organ called the gallbladder, which is on the undersurface of the right lobe of the liver. The gallbladder is an organ which measures 10 centimeters in length and comprises nearly 30 to 50 ml of the bile. Having seen the structure of the liver, now let us see what are the functions of the liver. In our body, the liver brings about 5 major functions: the synthetic function, metabolic function, excretory function, homeostasis, storage, and bile production. The synthetic functions of liver include the synthesis of plasma proteins, the synthesis of cholesterol, and also the other lipids. Metabolic functions of liver include its regulation of the carbohydrate metabolism, amino acid metabolism, cholesterol metabolism, and lipid metabolism. The excretory functions of liver include the elimination of the drug metabolites as well as excretion of ammonia. Liver also plays an important role in maintaining the homeostasis as measured or as reflected by the blood glucose metabolism. The liver is also a storage site for the vitamins, and it also is the site for the bile production. Bile is important for the emulsification of fats. Having seen these different functions of the liver and their importance in the body, it is important to understand what would happen if these functions are lost by the liver. So, what are the situations where the liver function is altered? How do you assess the function of the liver? And what are the different types of tests that can be done to assess liver function? Liver function tests become essential under conditions like jaundice, alcoholic liver disease, diabetes, and coagulation disorders. So, under these disease conditions, how do you assess the liver function? The liver function tests can be broadly divided into the tests of hepatic injury and the tests of hepatic function. The tests of hepatic injury and the tests of hepatic function can now be further classified as two different groups of tests: tests based on laboratory findings and the tests based on the clinical aspects. The laboratory findings include tests of hepatic excretory function, the tests of liver enzymes, the tests for plasma proteins, and some special tests. The tests to assess the clinical aspects, this include the markers of liver dysfunction, markers of hepatocellular injury, and markers of cholestasis. Now, I will give a brief overview of the various liver function tests which are associated with different functions of the liver and the diseases in which this function of the liver is going to be affected. So, amongst the functions of liver which I have outlined previously, the first function is the synthetic function. Synthetic function of liver is altered under diseases like a chronic liver disease or the chronic hepatitis. So, when the synthetic function of the liver is affected, what are the tests which are going to indicate the presence of either a chronic liver disease or chronic hepatitis? These tests include measurement of the plasma proteins, albumin levels, serum A by G ratio, and measurement of the prothrombin time. These tests will be useful for diagnosing the liver conditions like chronic hepatitis. The second function of the liver, which we have discussed, is the excretory function. Liver, as I have told, is the site for the metabolism of the various drugs, and it is also the site for the excretion of toxic metabolites. This excretory function of liver is altered in the diseases like the jaundice as well as other conditions. So, what tests need to be found to analyze the excretory function of the liver? So, jaundice, it can be an obstructive jaundice, or it can be the hemolytic jaundice, or it could be the hepatocellular jaundice. Under these conditions, the tests which are useful for diagnosing these liver diseases include the measurement of the serum bilirubin levels, urine bilinogen, urinobilinogen, urine bilirubin, and so on. Now, tests for metabolic function of the liver, this includes measurement of the blood ammonia. Ammonia tests can be used for diagnosis of liver diseases including the liver cirrhosis. Then, coming to the homeostatic function of the liver, homeostasis of liver is affected under diseases like the Reis syndrome, fulminant hepatic failure, and hepatocellular damage. The prothrombin time coupled with the vitamin K can be used as the test for diagnosing the impaired homeostatic function of the liver. These are the tests which are based on the laboratory findings. In my previous slide, I have also told that there are certain liver function tests which are based on the clinical aspects. So these tests are basically the tests for the synthetic function of liver, which involves the synthesis of the liver enzymes. Liver enzymes are altered in different disease conditions such as obstructive liver disease, alcoholic liver disease, and viral hepatitis. Now, what are the liver enzymes which are useful for assessing the viral hepatitis or the alcoholic liver disease? Same way, what are the enzymes which are altered in obstructive liver disease? The various enzymes which are synthesized by liver, these include the aminotransferases, that is alanine aminotransferase, aspartate aminotransferase, along with other enzymes like alkaline phosphatase, gamma glutamyl transferase, and 5' nucleotidase. The serum transaminases, including alanine aminotransferase as well as aspartate aminotransferase, are altered under liver diseases like the alcoholic liver disease and viral hepatitis. The enzymes like alkaline phosphatase, gamma glutamyl transferase, as well as 5' nucleotidase are altered under obstructive liver disease. So, by assessing the various biochemical parameters, including the plasma proteins, albumin levels, A by G ratio, then ammonia levels, then the serum enzymes, the prothrombin time, it is possible to diagnose the different types of liver diseases like alcoholic liver disease, obstructive liver disease, cirrhosis of liver, and chronic liver disease, and also the jaundice. Thank you.